Britain is braced for tragedy of 45,000 needless d.eaths. A team of healthcare weather analysts says the service faces a combination of conditions which will make this winter especially dangerous. Sub-zero temperatures setting in are expected to be extreme and prolonged for weeks, possibly months, and have arrived earlier than usual. It is said to be the worst winter for the NHS since 1978-1979. Scientists say plunging temperatures are likely to trigger deadly heart problems, strokes and respiratory conditions in the elderly and vulnerable people. At the same time, new figures show hospitals nationwide are already at breaking point, with record numbers of cancelled operations and bed occupancy at peak levels across many trusts. The figures have been described as alarming by experts who say not enough is done to protect pensioners from unnecessary cold weather deaths. Dr. Adrian Boyle, a consultant in emergency medicine at Addenbrooke's, Cambridge, said, "The cold winter forecasted will put more pressure on already dangerously overstretched emergency departments. We are already in a situation of near-permanent crisis and this will put lives at risk." Dr. William Bird, a GP based in Reading, who was the clinical director of the Health Forecast Unit at the Met Office until 2008, said, "The system cannot cope with the load. We urgently need to take measures to prevent these tragic deaths which are entirely preventable." Dr. Bird runs Intelligent Health, which is this week launching its winter forecast workload for the NHS, an early warning system that predicts weather-based demand. He said, "We are experiencing a massive change in the weather. This is not just a brief cold snap. It is likely to be prolonged and very cold. Those over 75 are hit hardest. The biggest impact will be on colds and respiratory diseases like flu, but also there are likely to be an increase in heart attacks and strokes because when people get too cold, blood thickens and blood pressure rises, putting the cardiovascular system at risk." Dr. Bird said, "We need more staff and more beds to cope. The situation is a disgrace. Housing stock is not good enough. There is still fuel poverty, and this is a problem which has not improved with the drop in living wages. Many hospitals are already at tipping point. It won't take much to tip them over. The whole system is at breaking point. Research shows for every degree drop in temperature below what is considered normal in winter there are 10,000 extra deaths. Separate studies show there is also a daily rise in respiratory infections of up to 20%. Combining this research with the weather predictions, experts are confident this will equate to at least 45,000 unnecessary deaths. Britain has one of Europe's highest winter death rates, only superseded by Malta and Portugal. Calling for urgent action, Charity Director Carolyn Abrahams, of Age UK, said, "Many older people live in poorly insulated homes and worry about turning up the heating during the cold months, increasing their risk of ill health. The NHS and social care are under unprecedented strain and older people are not always getting the help they need to nip emerging health problems in the bud." The Department of Health said, "The NHS has more robust plans in place than ever to cope with winter, supported by an extra £335 million announced by the Chancellor in the autumn budget, on top of the previously announced £100 million for A&E departments and £1 billion for the social care system."